Hi everyone, my name is Nick Wilson, aka the Disabled Adventurer, and with me today I have
Jade Wallace,
from
Rise for Disability.
There we go.
And I am Isaac Harvey, MBE.
Had to add the MBE in, didn't he?
Absolutely.
Put it in there. And I realised it's World Mental Health Day. So I thought it'd be great because we're together doing some filming and looking around Milton Keynes anyway for the Rise for Disability Milton Keynes event on the
22nd of October.
22nd of October. Awesome, well done. Where we're going to be doing a campaigning for mental health and suicide amongst people with disabilities.
Yep, that's one of the campaigns for sure.
So actually we thought, well, why not have a bit of a chat about it now for World Mental Health Day on the build up to Milton Keynes Day itself. So let's start first with yourself, Jade. What is your lived experience and why is it so important for mental health to be focused on specifically within the disabled community?
So specifically for myself, I have got a physical disability as well, but I'm also neurodiverse, and I would say from a mental health perspective, the disconnect between neurodiversity and mental health services is the thing that has been the biggest impact for me from a mental health perspective. So I was late diagnosed ADHD. I was referred to the mental health team, so from the doctors after the referral, I was diagnosed through the NHS, came under mental health, started off quite well, regular psychologist meets, talking about medications, but then the only option through occupational therapy was like a group session for everyone and anyone under mental health with anxiety or any other kind of, you're like bagged in together, if that makes sense. Which was okay, but when you've got people that feel so far disconnected from your own symptoms, it actually can create more isolation as well. So I tried to find my own ADHD coping strategy, counsellor or therapist, etc. And from learning more about myself through them, that has been a better therapy than the mental health services, but it also allowed me to ask for different options and routes to mental health, but then NHS wouldn't support them kinds of things. I felt that my emotional stability and emotional regulation was something that was my biggest issue within mental health. I would constantly bring this up in my reviews, and I ended up getting misdiagnosed with BPD, and they gave me, which is borderline personality disorder or EUPD for anyone that doesn't know, because I said about emotional regulation and suicide ideation, which I know you're obviously going to press on, but where I'd had loads of conversations with people that were also autistic and ADHD, that is a symptom of it. So that wasn't recognised by mental health services because of the training that they have, and they don't specialise in neurodiversity.
Isaac, you are a big public figure, disability advocate. During this year, you've been very open about the struggles that you've been on, especially over the past few months. How, in your lived experience, how do you feel the mental health support provision is, and does it cope well enough, or does it provide the right kind of support specifically to the disabled community from your lived experience?
So I have never gone down the professional routes of mental health and getting support that way. So I couldn't talk on that behalf. However, I'd like to go on the point of, that peer support between you two, especially when I've gone through some very challenging times. I know I can speak very openly and honestly about that. And I also find it's very good for me to share that on my public social media, because it's just a bit of a way of me being able to be honest with myself as well as my audience, because for a while now, even though I have shared the reality of disability, people still feel like, oh, he's got an MBE, he's jumped out of a plane, he's got all of this, that. It's all well and good for me, but actually the total opposite, and it's been a total, well, constant battle that's been going on for feels like years now, with access to work and social workers. It's been a constant battle, and when I've tell people, before I just told people on social media, when I told people I don't have any support, people were like, oh really? Like they were so shocked to hear that. So I thought, you know what, it's time for me to just be really real about it. And I feel a lot better from doing it. But then another thing which plays on my mind is when you do say it so negatively, that then affects the people who are going to support you. So it's like a double-edged sword of how much you can share online to what you want to, and it's just all over the place really when it comes to being real about disability. You know, the constant battle is like, oh, if I say this, then I'm not going to get any support. If I say that, then I'm going to get minimum support. It's just, you just don't know what you can and can't say and how that's going to affect you. And then you don't know who you're going to be paired up with, and they don't usually understand disability, and they put loads of barriers up. They're the gatekeepers to what I'm entitled to, and it becomes such a huge challenge. So it's, yeah, it's just all over the place really, and that really does affect me mentally. But again, I'm very grateful to the community and yourselves for helping me when it's been very difficult.
Do you feel if you needed specific support, I wouldn't say into crisis. You and I have spoken a lot about the different levels, and there not being enough levels. You don't go from poor mental health kind of straight into crisis, the bits in between. But if you noticed that your condition was declining and your mental health was also declining a lot, do you feel that there's the right kind of support for you to be able to call on to?
No. Short, fast answer to that. From the experience that I've had, even when we talk about suicide ideation, and for me, with my neurodiversity, disability, it is a symptom of it, that when things become too much, I have sensory overwhelm and shutdown, and it's like a sense of escapism where at that point it feels impulsive and I just want to get out sort of thing. But now I recognise that from speaking to other people with that symptom, it's allowed me to put my own measures in place, but nobody from mental health advised me on that. In fact, they signposted me incorrectly. I called crisis lines because that's what I was told to do, and been put on hold for 45 minutes, had the phone call disconnected, and it's pretty much been my husband that's supported me through any moments like that. I'm now in this kind of grey area where I'm not under mental health and I can't go to my GP. So my GP won't look at my meds and won't change my medication, and I'm not under mental health, so I literally have no support at all now.
Well, I mean, the three of us, we've helped each other a lot.
Yes.
And I definitely think, you know, I ran a men's support group for 3 years, and I know how much that helped me in very dark times. Have you got a social worker or someone like that?
Oh yeah, I have a social worker. Yeah.
So at any point, have you been offered mental health support because of your disability?
No, but the way that they've dragged things on, they should be giving me mental health support because of how much barriers they keep on putting up.
They create the need for mental health support.
Exactly.
I'm sorry to say, but...
No, they do.
And what about your family, your mum, your sister? They're very much involved in your life and try and help and support you as much as they do. Have they ever been offered mental health support?
I don't know if they have been offered it, no.
I mean, that was something that
I was going to say, I know a standard, usually if you have a child that's born with a disability or they get a disability as a child, this is not an adult, just to clarify, the parents are offered mental health support, but there's not like a standard signposting service for if somebody has a disability later on in life, or even are born with a disability and their life changes in some way, or etc. It should be like a standard thing that goes.
Yeah, and like, so for people who don't know me and my background, I can relate to that massively. You know, from becoming a chair user, a declining spinal injury and a fibromyalgia diagnosis, and experiencing chronic nerve pain 24/7, I was never offered any mental health support when I got any of those diagnoses. I was in the army for 14 years, so being very active, to suddenly being very reliant on others and not being able to do much, and that isolation and not having connections within community. But when I'm talking about community, it's like physical community where I live. And whilst I've got these amazing guys and friends, family that I can reach out to, there's no one specifically for me locally to come and help. Recently, I reached out to Scope and said that I was struggling with suicidal thoughts, and immediately they sent me a message saying, ring 999, take myself to A&E, or ring Samaritans. And yet Samaritans tell me to go out and get some fresh air and all these kind of sort of stuff. As a chair user, we struggle to do because lack of accessibility. And I have suicidal thoughts, but I'm not in crisis. So they're telling me to ring a crisis line, but I'm not in crisis. I'm in touch with my emotions. I'm very relaxed, calm,
open and honest about it.
Yeah, and I'm going, look, I question what's the point. What's the point in lying here in loads of pain, struggling with accessibility, not being able to go out and feeling totally alone? What is the point?
Where do we go from here in getting the right education? Like, even from a point when you've reached out to me, and because I'm neurodiverse and I'm a bit shit with words, you get worried about what to say back. So it's almost like there needs to be an education even amongst our community on how
100%.
to support and talk to each other.
Yeah, I totally agree.
What I mean?
We're going to speak up a bit more because the weather's decided this is a sign, right? And it's showing how bad mental health is.
Absolutely.
He's crying. There's tears coming from heaven, man. So the whole point of us sharing this stuff is about Rise for Disability, and when it comes to Milton Keynes on the 22nd of October, and the campaign that we're starting, aren't we, on mental health and disability. And do you want to briefly tell them what Rise for Disability is going to be doing within that campaign and what that looks like?
So RISE stands for Resource Identify Solutions and Equipment for Disability, and within the event we have something called the Community Campaigns Project, where we will be taking, the idea came from previous events we've done where we've done people's panels and discussions like this, and you always find there's useful information that come from them, and the people that attend find them very valuable, but nothing's done with that information. So the idea is that we will have a panel discussion. We've already pre-created a survey from the input of the speakers and people and partners involved in the campaign, which we will get the audience to participate in during the panel from having the discussions. We will also be taking notes and minutes of the panel to put into an annual report. So this will go on as a project for a whole year with the idea to create an annual report or white paper, same thing as such, I don't know, I'm not legal, but that kind of thing to then be taken forward to try and implement policy change in that particular field. So that's the idea behind it.
And this whole conversation for us is a very, very brief kind of talk about it, look into it, just to raise awareness of what is happening on the 22nd of October and what Rise for Disability are going to be doing, campaigning for better mental health support, specifically within the disabled community and also within suicide prevention. So whatever you are doing on World Mental Health Day, stay safe, keep going. It is possible to get through those dark times. Share with one another, because that's what's really helped us individually. And keep an eye on Rise for Disability, and hopefully we will see you on the 22nd of October. I'll put the links in the comments below, and see you soon.
And if anyone can't attend, we'll still send the survey out, because the mental health survey, especially on World Mental Health Day, it's really important to get that information so we can put that change in place.
All right. Cheers, guys.